Okay, hello everyone. Good morning. So for today, we will have our discussions, our new discussion that talks about the occupied bed that was assigned to us by Ma'am Robian. So since we already done with the unoccupied bed that is reported by the last presenters, now we will go deeper on the occupied bed. But before that, let us have first a brief discussions regarding the definition of bed making. So, what is bed making? So, when we say bed making, we have the two types, and that is the unoccupied bed and occupied bed. So, since we are done with the unoccupied bed, let's proceed to the occupied bed. Now, what is occupied bed? So, when we say occupied bed, it is making the bed where the patient's physically available in the bed, or the bed is being retained for the patient. Meaning, you need to make a bed even though the patient is still in his or her bed. If a patient is unable to move or leave the bed sheets, you will need to change the bed sheets while the patient is occupied in bed. So, or in short, even though you need to change the bed sheets, even though the the patient is still in her or his or her bed. So that is the meaning of occupied bed. Now, what is the purpose of occupied bed? So of course, to provide a neat and clean bed to the patient. So that is the main one of the purpose of occupied bed. Second is to refresh the patient who is confined to that bed. And next one is to remove the crumbs from the bed. And lastly, to make the patients feel comfortable. So to make the patient feel comfortable, you need to apply this occupied bed, or you need to change his or her bed sheets or his or her pillowcase. So that is the purpose of occupied bed. Understood? Okay, now so let's proceed to the procedures of occupied bed.
Marie Masangay, BEd 3A. So I am going to discuss about the occupied bed procedures. The first procedure is wash your hands, don gloves, bring clean linen to the patient's room. So basically, hand hygiene is the most important um, part of practice for healthcare workers and is the single most effective way to stop the spread of infections. Basically, when we say hand hygiene, it is really important. It's because is a general term to describe any action of hand cleaning and refers to the removal or destruction of soil, oil, or organic material, as well as the removal of microbial contamination acquired by contact with patients or the environment. The next one is identify the patient and tell him you will be changing his bed linens. So there are times that patients may have contagious germs that are left on sheets and bed linens, as well as their gowns. So it is very important to identify the patient and tell him or her that you will be going to change his or her bed linens because these germs must be fully sanitized before these linens may be able to be used again. If not, there is the risk of spread of infection or disease between patients, which is less than desirable. The next one is move any furniture away from the bed. It is really important to move all the furniture away from the bed for the safety of the patient. The next one is Raise the side rail on the side of the bed, prevent fall. Adjust the bed to a comfortable working height to prevent back strain. So examples including the raising the side rails when a patient is on a stretcher, recovering from anesthesia, sedated, experiencing a involuntary movement, or on certain types of therapeutic beds to prevent the patient from inadvertently falling out of the bed. Number five procedure is if the patient's condition permits, lower the head of the bed to ensure tight fitting, wrinkle free linens. So make sure that the bottom sheet is snug on the bed, no wrinkles, because wrinkles are uncomfortable for the patient and restrict circulation and cause skin breakdown. The next one is cover the patient with a bath blanket to avoid exposure and provide warmth and privacy. So, bath blanket is a flannel covering used to prevent chilling when administering a bed bath. So, that is very important to cover the patient with a bath blanket. So, the next one is if the mattress slides down when the head of the bed is raised, pull it up toward the head of the bed. So basically, mattress sliding is often caused by lack of friction between the mattress and the bed frame. So this can happen when there are missing rails above the slots, when you have the wrong size frame, or if you have an old mattress. So you need to um, pull it up toward the head of the bed. When, if the mattress slides down, huh? The next one is roll the patient to the far side of the bed and position the pillow lengthwise under his head to support his neck. So in the lateral position, the patient lies on one side. So some common procedures that may require a patient to be positioned in the lateral position include back surgeries, lower extremity surgeries, um, and etc. The next one is loosen the soiled bottom linens on the side of the bed nearest you. Then roll the linens toward the patient's back in the middle of the bed. So pull the bottom sheet over the corners of the head and foot of the mattress. Opening linens on the bed reduces strain on the nurse's arms and diminishes the spread of microorganisms. So the next one is place a clean bottom sheet on the bed with its center fold in the middle of the mattress. So bottom sheet helps to absorb moisture and prevent dislodgement of the bottom sheet. So that is why it is important to place a clean bottom sheet on the bed. The next one is fan fold the remaining clean bottom sheet toward the patient and place the draw sheet if needed about 38 centimeter from the top of the bed with its center fold in the middle of the mattress. So it is important to follow the on how to fan fold all the remaining clean bottom sheet toward the patient. For us, and the last but not the least is the fan fold the remaining clean bottom sheet toward the patient and place the draw sheet if needed about 38 centimeters from the top of the bed with its center fold in the middle of the mattress.
Okay, next, let's proceed. Raise the other side of the rail and roll the patient over the soiled and fan-folded linen to the clean side of the bed. So why this need to raise the other side rail? Of course, to avoid falling objects to the patient. So that is the main reason why. Why do you need to raise the other side rail? And then um, roll the patient over the soiled. So the soiled there, class, is the dirty. Yes, the dirty. And then fold the linen to the clean side of the bed. Actually, you can perform this. You can ask the man help to the patient if ever kaya ng pasyente. But then if not, then you can ask other employees or other staffs in the certain place or in the certain hospital. So next one is move to the unfinished side of the bed and lower the side rail nearest to you. So kung kanina, we talks about to raise the side rail in order to avoid falling objects. This time naman, you need to lower the side rail nearest to you. So, and then, when removing the soiled linens, do not forget to wear gloves before handling it. So take note, never carry soiled linen against the body. So just carefully roll up and put it in the laundry bag so that it can prevent contaminations. Next one is pull the clean bottom sheets taut. Secure a fitted sheet over the mattress corners or place the end of the flat sheet even with the foot of the bed and meter the top corner. So when we say bottom sheets, it is used to cover the bed after mattress cover. So it's either a flat sheet or a fitted sheet. Anyway, what's the difference between the flat sheet and the fitted sheet? So when we say fitted sheet, it's also known as the bottom sheet. So it is designed to set on top of the mattress to protect it, and also they need to fit the the bed sheets so that the patient can feel soft and comfortable. So that is the fitted sheets. And when we say flat sheets, it is designed to be placed between the patient and their blankets. So why it is important to why this need to use linen saver pad? So it is provide because this linen saver pad, it is provide, but depending on the patient actually. So if it is need to use or not. So the main focus of this linen saver is to protect the mattresses from the incontinent patients. So that is the why we need to use this linen saver pad. Again, it depends on the conditions of the patients if it is required to use that or not. So next, assist the patient to the supine position of his condition permits. So you need to assist the patient, of course, to the supine positions, but again, it depends on the conditions of the patient. So this supine kasi are used if ever you need to have a procedure, so just like having a cardiac abdominal and etc. So you will use this supine position and then you will assist, but if not, then it is not really needed. So again, it depends on the conditions of the patients. So next, remove the soiled pillowcase and place it in the laundry bag. So of course, again, when removing a dirty or a soiled, just like pillowcase or the bed sheets, you need to wear gloves, reusable rubber gloves, so that it can prevent contaminations. Then After that, you can place it in the laundry bag. Meron kasi laundry bag na nakalagay dyan sa kilid kung saan gumagawa ng bed making. Okay? So, next. Unfold the clean top sheet over the patient with the rough side of the hem facing away from bed to avoid irritating the patient's skin. So allow enough sheets of the top of the bed to form a cuff over the spread. So to avoid irritating the patient's skin, especially those patients na sensitive yung kanilang mga skin, you need to unfold the clean sheets over the patient. So when we say unfold, you need to open it or to spread it out over the patient. So that is the unfold, and then allow enough sheets at the top of the bed to form a cuff over the spread. Next, remove the bath blanket from beneath the sheet and center spread over the top sheet. So, you need to remove the bath blanket. Yung mga blanket na mga hindi na pwede, then you need to remove it. So, next one is make 7.6 cm to pleat or vertical tuck in the top linens to allow rooms for the patient's feet and prevent pressures that can cause discomfort, skin breakdown, and foot drop. So, that's what I've mentioned earlier. So, you need to make 7.6 cm toe plate. So, by the way, what is this toe plate? So, a toe plates in the bed making, it is the plates in the sheet that allows a patient in the bed to be able to move his or her feet, and so that it can prevent cause discomfort, breakdown, and of course the foot drop. Next one, tuck the top sheet and spread under the foot of the bed and meter the bottom center. So, okay. Paulit-ulit, no? So, as what I've said kanina, tucking the sheet to allow room for the patient's feet and prevent pressure. So, to avoid unnecessary things, we need to tuck the top sheets. So, in order to allow the patients to make fit and of course to prevent pressures. Next one is raise the head to the bed to a comfortable positions for the patient. Make sure both side rails are raised and then lower the bed and lock it well to ensure the patient's safety. So again, di ba kanina we talked that the side rails you need to raise and then you'll need to lower the lower naman. So, this time, you need to lock it. Yes, to ensure the safety of the patients. So, you need to raise the head to the bed to a comfortable positions for the patients. Lastly, return furniture to its proper place and place the call button within the patient's easy to reach. So, since everything is fine and everything is done naman, all you have to do is to return all the equipment that you use. You place it to its proper place. You need to return it into the proper place. So, kung saan mo kinuha, doon mo din yung babalik. And then the call button within the patient's easy to reach. So, and of course, since you are done with the bed making, you need to, of course, to remove the laundry bag and as well as to remove your gloves and the gloves that you used. So, you need to remove it. So, that's it. So, everything that you used is you need to return it properly. So, that would be our report for this topic. I hope you learned something and thank you.